Hey guys, welcome back to another episode of Matters of the Heart and Soul podcast. This is Janie, your host. And guys, we are talking all about brain wellness with Neurology Nurse Practitioner Mandi Counters. So, welcome to the podcast, Mandi.
Thanks for having me.
Yeah. So it's been like over 10 years you've been in neurology, pretty much specialized in headache education and stuff like that. But just go ahead and introduce yourself, Mandi. Tell our listeners a little bit more about you and how you are now spreading the word on brain wellness.
Yeah. So I've actually been in healthcare for about 23 years total, a little over 10 of those as a nurse practitioner. And almost all of my experience has been in neurology. And that's just an area near and dear to my heart because of that. And a few years ago, I got involved in functional medicine or got entrenched in it and absolutely started loving it. It was just a different way to look at health rather than our typical Western medical style of here's a Band-Aid for whatever problem that you have. So it's been a little bit of a change, but not a huge change in my practice because I've always been into the why of what's going on and just trying to get out there explaining more of the why to people and trying to help my patients and clients to identify what's going on with their bodies rather than just fixing it with a pill.
Exactly. So, for people out there who have never heard of functional medicine, what is functional medicine?
The way I like to describe it is functional medicine looks at the root cause of our problems. So rather than saying, oh, you have high blood pressure, here, take a pill for that, it's why do you have that high blood pressure? Let's look back in your life and see what happened that caused that so we can intercept the why and stop it from being a problem. And you might not need those medications or even the same doses, at least, for moving forward.
Exactly. And so far in your practice with functional medicine, what are you finding some of the root causes of, let's say, stroke or neurological dysfunction? Any of those autoimmune diseases, what are you finding as root causes?
Yeah, so there's a lot
I know.
as I've dealt
I
with
know
stroke.
that's probably a difficult question, but what
We
do
could
you,
talk all day probably on the
yeah.
causes, but just kind of quick and dirty. When we think about stroke risk factors in particular, we look at things that are things that we can change and things that we can't change. So as we age, we get more adept to having health issues. And we can't change that. We can't reverse our age. But things we can change are things that like stress and sleep and how we eat and how we exercise. And those are kind of the big components for any neurological problem is how we eat, how we deal with stress, how we deal with just life in general. And those lifestyle things actually have more of an impact on our overall health than even prescription medications do.
Wow. And I believe that. So, what would you say are some of the key, like if you had to give us two things that, and you just want to shout it out at the mountaintop to help people prevent brain issues such as stroke, like you mentioned, what are two things that you would mention to humanity right now? With
Mhm.
everything that we have going on, and we've had a lot of strokes, a lot of heart attacks, a lot of things that's going on since the pandemic, before the pandemic, but it's almost like things have really been highlighted since then.
Yep. Honestly, I think the two biggest ones that come to mind are nutrition and stress.
Okay.
And with the pandemic, with everything else going on, political changes in the world, stress is huge. So trying to find a way to mitigate that stress and really find healthy outlets for that. And some of those unhealthy outlets get into our nutrition. We start to self-medicate with sugars and alcohols and things that are not beneficial to us. And if we can really get back to eating whole, real foods, our body knows what to do with those. And that in turn will lead to less stress on our body. So those two things are really, really interchangeable and really connected.
Mm-hmm. And so, what is your recommendation for those people who are already trying to heal a brain issue?
Mhm.
Someone possibly that has had a stroke or some type of brain issue, tumor, any type of neurological functioning. How should they start to heal?
Mm.
That's not necessarily pharmacology, although that is helpful, right?
Mhm.
And we'll talk about that in a minute.
Yep.
But what are some things people can do to start healing themselves?
Mhm. Number one, after any kind of brain injury, whether it's traumatic brain injury or stroke or even an acute headache that somebody has right now, the biggest thing you can do is sleep.
Mm.
Rest is, there's been a lot of research to show that when we rest, that's when our brain heals the most. So if you can get good uninterrupted sleep, that's the best way you can do it. Sure, there are pharmacological ways for that, but there's also just general sleep hygiene, going to sleep at the same time, regardless of what day it is, actually sleeping in a dark area, don't have a TV in your room, things like that. Just getting that good uninterrupted sleep.
Yeah. Um, in your opinion, what do you think is the difference between the mind and the brain?
The brain is more of a physical thing that's in our body. That's what controls our thoughts, our sleep, our sleep wake cycle, our addictions or non addictions. Our mind is more of what makes us who we are. So we have a little bit of control over some of those things that our brain does, and our mindset is huge on that. How we just decide to look at the world will interpret what our brain tells our body to do. So anybody that's in it that is has stress in their life, there are two ways you can deal with it. You can be stressed, or you can choose to take it step by step, break down that stress, and try to come to a calmer state. We're all going to have stress. That's not going to go away. But how we can take control of our mind and choose to deal with that stress will tell our brain what to do with all those hormones in our body.
Hmm. And what has the last, let's say, 3 years done to our brains collectively
It's
that you've
yeah,
noticed in your practice?
I see a lot more stress and anxiety. People's blood pressures are rising because of the stress and anxiety. There is a lot of fear in society, not knowing what's going to happen with our economy, our illnesses. Some people who still are very scared to go anywhere out in public and very much are holed up by themselves. There's a lot more mental health issues because of that as well, because people are not socializing like they used to. So all of that is playing a huge impact on the health of our brains.
Yeah. And Mandi, are you seeing people inpatient and outpatient, or what is your work day like?
Yeah, most of what I do is inpatient still. I have started a program outside of the hospital for patients that have chronic headaches and migraines to try to look at more of the lifestyle factors. That's something that I don't have an opportunity to do in the hospital because it's brief visits there. But in the
Yeah.
hospital, it's all the acute things that are really sick people that are coming in because they've been putting off their health.
Yeah, and I think that's important to talk about because you're getting people when it's blown up.
Mhm.
Now we have a stroke, now our blood pressure's through the roof, now we have some type of traumatic brain injury. And sometimes you can prevent traumatic brain injuries like accidents and stuff.
Right.
So not talking about that, but things that we can prevent. How do we bridge it? How do we bridge it? Because I'm also a nurse practitioner, family. So I am more in the community. I try to do a whole bunch of prevention so
Mhm.
that people don't have to see you in the hospital.
Yeah.
So how do we bridge it? How do we get more people to not have to be going through some real life changes?
That's a really good question. Once I get people beyond that acute phase in the hospital, I do try to do some of that teaching because I know uh, the folks that where I send them, like you in the primary care, you guys don't have as much time to deal with patients dealing with all of these lifestyle issues that they need to have. 15, sometimes 30 minutes. I think max was an hour that I had with some patients when I was doing the outpatient world. And even then,
That's
it's
no
so
more.
hard. No,
Yeah.
it's so hard to deal with any issues in that little bit of time frame, much less really go into the depths of what's going on with a patient. So I myself try to bridge that as much as I can, going through as much education with the patient before they leave the hospital as possible. I know that's not all practitioners, but there's a lot of Dr. Google things. People look things up afterwards, and they're sometimes finding good information, sometimes not finding good information, which is where I'm hoping that shows like yours and mine ultimately will do the same thing and educate people beyond that 15-minute block of time that they get with the provider.
Exactly. And guys, it's true. Like it's 15 minutes, it's 20 minutes. Like Mandi said, an hour is really not heard of anymore.
Yeah.
It's not. And this is actually good because we'll talk a little bit about the healthcare system and where
Yeah.
we are and what we need to do better, because we have a lot of area for improvement. And what we've been doing good. And
Mhm.
sometimes we don't get those pats on the back. You know that as well as I do. And you have to be built for this type of work. I think it's a calling. I think it's a mission. It's a part of who you chose to be when you decided to come here on this earth in this incarnation. So um how do we do it? Like, how do, first of all, and I know some providers were kind of silenced because there was things that they felt that could have been different when we've had the pandemic and things like that. How are you doing it in inpatient in the hospital? What are you seeing that could be changed? And we're not talking about any specific health system or anything. We're just talking general healthcare across the board.
Mhm. There are so many limitations that get put on us in this system that we have to
Yes.
follow specific rules. Even a couple of years ago, before the pandemic hit, I came up with a sheet, for example, on diet recommendations based on my years of experience as a nurse practitioner and my own personal research that I had done into the benefits of health and well-being for our brains. And I came up with a sheet of what to eat versus what not to eat in each food category. And I was allowed to give that to patients as long as I prefaced it by saying, these are my recommendations. This is not the ADA recommendations, because they they would not let other staff members pass it out, for example. So I couldn't give it to one of my nurses and say, hey, can you go give this to the patient? I had to personally give it out and give the caveat that this was my recommendation, not the ADA. Now,
Wow.
that being said, my patients loved it because it was all a conglomeration of books upon books that I had read and put all that information together. And they loved it because they didn't have to then go do the research themselves. And it was easier to swap out foods that they should be eating versus things that they weren't.
Mm-hmm. That's
It takes more
interesting.
practitioners like us to do things like that and have
Yeah,
the
and
guts to do that.
it's gonna take people, I think, kind of taking it upon themselves in whichever way you can, in
Mhm.
whatever specialty you feel that this is where you're called to be, um, and it's gonna take a group effort
Mhm.
because Mandy's right. There's so many restrictions on what you could do, what you can say, and I think that's a big problem. It really is. So,
Mhm.
where do you think we're headed in healthcare right now?
I think people are getting tired of our normal system. And I know as a provider, I'm tired of being told what I can and can't do from an insurance standpoint. There are things that I would love to have my patients do that I can't because they're not covered. So I think a lot of it is going to go to what people can find on their own, and almost like a concierge type of system when people are going to start looking outside of the normal healthcare system. Where can I get health? I might have to pay a little bit more for it, but where can I get it that it's actually going to benefit me?
Yeah, and that's such a good point. If you're out there and you're listening to this and you're fed up as a patient, you're not getting what you feel you need, you may have to go outside of the normal healthcare system. You may have to reach out to providers who aren't taking insurance,
Mhm.
because a lot of times insurance is a headache. They
Mhm.
don't want to pay providers for all the work that they're doing, all the education, and some providers just can't afford it because it takes a lot of personnel to cover insurance and all of that. So just keep an open mind, because I do believe the healthcare system is changing.
Mhm.
The old system is breaking down, a new one is building up, and if you haven't looked around, you should. You could see changes now. I mean, there's tons of telemedicine going on. People don't even want to go in the office anymore. They
Mhm.
don't want to go in the emergency rooms. I've had patients flat out tell me, I'm not going there. I'm not going there. My family member went and never came back. It's so many things, and is we can't point the finger at no one. I just think that we have to look for solutions to meet the needs.
Absolutely.
Yeah.
Absolutely.
All right, let's talk about headaches. Let's
Yeah.
talk about headaches. Tell us whatever you want about headaches, because I think everyone at some point deals with a headache, whether it's sinuses or, anything. So tell
Yep.
us what we need to know about headaches from a
Yeah. So
wellness point.
there's so many things we can talk about, my goodness. But some of kind of the bigger things right now, we are headed into winter. We are headed into different changing seasons. This is often a big time where people will start to get sinus headaches with allergies. All of the harvesting of foods that is going on in all the fields, especially in the Midwest where I am, there's a lot of that can trigger headaches and allergy type of headaches. But in general too, just stress headaches are huge right now because of all the changes that we've discussed. And so people are having a lot more stress related headaches, whereas they'll say, well, I haven't had a headache in a long time. Why am I having all these headaches now? Well, look at your stress level in your body. You are stressed to the max right now with everything that's going on. So there are kind of the top 5 things I usually like to talk about with people. And those things are sleep, as we mentioned, nutrition, making sure that you're getting good, healthy food, making sure that you get good hydration. So, not drinking enough water is a really common one, too. People that are more active tend to be a little bit better at getting water in, but not everybody. Um, and then our, my goodness, I've lost track of where I was. Sleep, nutrition,
Yes,
water,
sleep. Yeah, sleep, water,
stress.
nutrition. You said,
I'll come back to that last
yeah,
one.
that's okay.
I'm having a brain escape
Yeah.
at that moment. Um, but so for example, with sleeping, making sure that you get a good amount of sleep every night, uninterrupted, as we mentioned. With our water intake, you should be getting half of your body weight in ounces of water a day. So take your weight in pounds, divide it by 2. That's how many ounces of water you should get in a day. Most people aren't getting that. And dehydration leads to a lot of headaches. It leads to increased risk for strokes and other neurological problems as well. So just general good health, getting that in.
Mm.
With diet, there's a lot that we can go into a whole little rabbit hole about diet as well. With that, there are foods that you should get in every day. And I just actually did a little video on my social media account yesterday about getting in protein. So women especially need to make sure we get enough protein in our diet. And there are a lot of foods that trigger headaches that can cause a lot of inflammation in our body. So there's a whole gamut of foods, nightshade vegetables being one of them. And a lot of people haven't heard of nightshade vegetables. That's all the good things you put in like a fajita, your peppers,
Mhm.
your onions, eggplant, not so big on my case, but
Yeah.
some of those foods that are really important staples in a lot of people's diets can actually cause a lot of inflammation in our bodies.
Mhm.
Coffee, that's a big one for people. And sometimes they need that daily coffee, but that daily coffee could be giving you your headaches as well. So there's a huge array of foods that can trigger headaches. And some of that is just going through a daily checklist of what are you eating? And then do you get a headache afterwards? Can you keeping a headache diary and seeing what in my diet am I doing that's causing problems?
Yeah.
There's a whole that can be a whole discussion on itself too.
Yeah. And do you think genetics play a big role in certain foods? Because not I truly believe not everyone
Mhm,
can eat the same things. Like you really should know your blood type and
mhm.
DNA and just kind of things, how things run in your own family to see what foods best resonate with you. Because some people could eat things and some people can't.
Absolutely, absolutely. My mom, for example, so migraines run in my family. My mom was a big activator with MSG, so any foods that had MSG in them.
Mm.
And lo and behold, my sisters and I all have the same issue. When I was exposed to functional medicine initially as a patient, I did genetic testing with that and found there were several foods that I liked that were thankfully really good for me based on my genetics, and some that were not, and they were going to be more triggering for inflammation in my body. So
Yeah.
it's not a common test, but it's something that can be done to really see what foods are going to best benefit you.
Yeah, for sure. Um, let's talk a little bit about mental emotional
Mhm,
with headaches and
mhm.
also how mental emotional can show up physically, such as a headache.
Yeah.
What is your take on that?
I think our brain and our body have a huge connection. So when we talk about somebody that has chronic headaches, there's a bit of a downward spiral that we get into. So first off, if you have stress that causes your headache and you have increased stress, your headache's going to get worse, which is going to increase your stress again too. So it's again
Mhm.
this downward spiral. They both play on each other. But people that have chronic health issues, it's sometimes a trick to figure out which one came first, the chicken or the egg. Was it the chronic health issues that came first, or was it the stress and headaches that came first? So when we look at that, we really kind of have to tease those two things apart because they really play into each other. I had patients years ago who were chronically sick. They just did not look well when they were coming in, and they never had a positive thing to say in the appointment. It was always everything negative. And it's really hard to break that cycle when all you see is negativity. It's really hard to then look for that positivity. However, if you can change it, if you can change your attitude, change your response to your stress level, and realize that you have more control than you think you do, those symptoms can actually start to improve. I've
Absolutely.
I've cared for many, many people who they have no explanation for their ailments, their illnesses, except for potentially stress. When we really try to break it down, all the tests that we do in the hospital come back negative. Everything looks like the patient should be fine, but they clearly have physical symptoms.
Mhm.
And then I have a conversation with them and say, okay, well, what's going on in your life? How is your stress? And then all of a sudden they break down and they start crying. And then it all comes out. And we realize, okay, what you need is psychological help. This is not a physical problem. You have a physical manifestation of a psychological need.
Yeah. And I personally believe that most trauma, most issues lodges in the physical body if you do
Mhm,
not know how to heal it before
mhm,
it stays stuck there.
mhm.
And I think people are definitely not putting that together.
Yeah.
And personally, I think providers, a lot of providers aren't putting it together.
Yes.
Um, and I think that we have to do a better job as healthcare providers in screening for stress.
Mhm,
And we don't,
mhm.
because I think we go straight for wanting to just fix and treat, and then next
Yeah.
get next person because it's
Yeah.
how it's set up, right? Our
Yeah.
time is
Yep.
limited. We have all these patients to see. We just don't have time to sit there with patients. So I think we do need a complete overhaul in
Yes.
healthcare, and I definitely do things a whole lot different in my own clinic, and I love it. And but it's true. I think that we have to do a better job. Now,
Yeah.
I think that patients also has a responsibility in their own health.
Absolutely. They have
You
more
know,
responsibility than they
we
think
are
they
your
do.
partners in health. We are human. We're practicing science. We're practicing medicine, and then medicine that was taught according to a system, maybe an old system too.
Right.
And we are helping you. We're your partner, but you have a responsibility as an individual in your own healthcare.
Absolutely.
Yeah.
Absolutely.
So, Mandi, can you touch a little bit on like left brain versus right brain functioning, and how that plays a role in maybe some issues that we see, bipolar, and some other mental issues that we may see that could be deemed neurological as well?
Yeah. Yep. So our left brain is kind of thought about as our logical brain. That's where, for most people, our language center is on the left side of our brain as well. About 85%, 85 to 90% of all people who are right-handed, your language is on the left side. And about 50% of all people who are left-handed, the language is also there. So overall, about 85% of all of us have our language on the left side of our brain, which is our logical side. So we're trying to break down and logically think about things, whereas our right side of our brain is more of our creative side of our brain. That's where we have a lot of impulse response. So if we are known as impulse buyers, for example, right brain dominant on that one because we're more into that last minute shopping bit. But we really need those two halves of our brain to work together in order to get us through life successfully. You can't always be that impulse person. And you can't always be the logical person because there's not always a good logical reason for things. But we really need to find activities that will bring both of those together. Years ago, when I started working in stroke care, I was reading all sorts of different articles about how you can actually help your brain and prevent things like dementia. And doing activities that activate both sides of your brain are really, really important. One of those being ballroom dancing, which we don't do often enough in our society anymore.
We
But
don't.
it's activities like that where you actually have to physically think about what you're doing and think about what your partner's doing when you're dancing with them. You're activating both sides of your brain in the same at the same time so that you can really keep things healthy.
Yeah. Is there any other recommendations you can recommend to help merge both brains?
Uh, Other activities would be like things that are creative and logical at the same time. So crossword puzzles. So you have to use logic to answer them, but you also have the creativity for the picture in them. So things
Mhm.
like that are also really helpful. Any kind of word puzzles, word and creativity. So as if you look at a lot of the new apps they have on phones, they have all these things with colorful graphics that are really pretty, and they catch the creative side of your brain, but you're using logic to answer the questions on there. So you're kind of not knowingly utilizing both sides of your brain with that as well.
Yeah. And when we sleep, is our brain still active?
It is very active.
So does
It
it
has
even shut off?
It's it never actually truly shuts off. It will always be going. And as we sleep, there are several different states of sleep that we need to get into. To order to effectively get good sleep, you needed to get into that REM state. And some people are really light sleepers and they don't really ever get into that REM sleep. So they can sleep for 8 hours, but if you don't get into that good sleep state, you're actually not going to feel refreshed when you wake up.
Mm.
On the contrary, if you get too much of that REM sleep, you can also feel really groggy when you wake up in the morning. So it's really important to find a good balance. Some of that you can control, some of it you can't. If you have too much alcohol too close to bed, that will prevent you from getting into a good sleep state. Again, some of those lifestyle things that we can do
Mhm.
before getting there. But absolutely, that's when our brain heals. So after a brain injury, after a brain trauma, that's when you really need to get good sleep because your brain is trying to heal and recover and create new connections and improve your brain health all over again.
Yeah. So let's talk a little bit about our neurotransmitters like dopamine and cortisol and serotonin. I'm often talking about cortisol a lot because it's our stress hormone. So
Mhm,
I'm constantly talking to people about that,
mhm,
just to be careful because anytime you stress and your cortisol stays up high, your body's working against you. So can you
mhm.
mention or share anything about that with our listeners?
Sure. So as you mentioned, yeah, the cortisol is our stress hormone. So when we get overly stressed, though, that cortisol level is going to be unbalanced. There are some straight up tests that we can do to check the cortisol levels, but unfortunately, they're not always super accurate. Sometimes if we're catching a one-off, it's not catching it on a true time. When I was going through my initial functional medicine testing when I was a patient, they wanted to check my cortisol levels at different times of the day because that will also make an impact on you. If you're a night shift worker, for example, instead of a day shift worker, your cortisol level is going to be different at different times of the day than somebody who works a different shift than you. And that cortisol can impact your daily thinking. It can make it difficult for you to comprehend what's going on, for you to focus on your work, and it actually increases the inflammation in your body as well. So sometimes our inflammatory markers go up as well because the cortisol level is up. And our body can sometimes compensate a little bit so that the cortisol is within that prescribed range that the lab checks it. But if you were to look at those inflammatory markers, they might actually be off. Serotonin, another one that can be thrown off, especially when we're talking about somebody who's got mental health issues. And that is huge for stabilizing our mood. And there's a huge stigma in society about mental illness and depression,
Mhm.
but sometimes that is just a hormone imbalance that needs a little bit of correction. So people are really oftentimes don't want to be on medications, but that's one time where it is actually helpful just to rebalance that serotonin and get it back to a normal level
Mhm.
again.
Mhm.
And then the dopamine I see because of Parkinson's patients. So
Yeah.
when our dopamine is what tells our body to move smoothly and appropriately. So when we don't have that correct level of dopamine in our body, we're not moving in appropriate fashions. And there are different neurological conditions. Parkinson's and Huntington's is the other one that are the primary ones that are related to our dopamine measurements.
Mhm. So how do we preserve I know you mentioned stressed,
Mhm.
but is there anything else we could do to preserve our neurological functioning? Or would you say like getting things like Parkinson is just we could live healthy, we could eat healthy, we could do everything, and then we could still get this disease?
Some of these neurological diseases, unfortunately, no matter what we do, we still might get them, especially if it's a genetic component. So if our family member had it, we're going to be more likely to have it. That said, a lot of it still breaks down to diet and how much we can really improve our diet. Anything that we eat that causes a lot of inflammation is going to increase the risk of any kind of vascular or neurological problem. There was years ago, I heard that there was a study that called dementia like a type 3 diabetes. So
Mm,
if we eat poorly, we get a lot of carbohydrates, a lot of processed foods in our diet, we're going to end up with things like that because our body just can't break that down and utilize it appropriately in the body. So
mhm.
rather than it showing up as diabetes, it shows up as dementia later in life instead.
Wow, that's interesting. And I mean, I think there's still a lot that we just don't know about the brain too.
Mhm.
Um, what's your opinion about that?
I 100% agree. It's I've heard it termed several times as the final frontier. We just don't have the answers for everything that's going on in the brain. For as many years as we've been researching it, no two people are the same. So even if you have two people that have the exact same neurotransmitter levels, we can check all the labs. They're all the same. Their bodies are going to look very different, and how they react to things around them is going to be very different. We just don't have an answer for that quite yet. There's a lot that we say, well, we think it's this, but we diagnose things based on ruling out other problems. And we can't really 100% say with all certainty that, yes, this is what it is, because we just haven't gotten to that point where we can answer those questions yet.
Yeah. And what do you think about the fact that a lot of research is saying that we only use 10% of our brain?
That's probably true also. I've seen some of the studies where they show that, like a PET scan, and show our brain activity and when we actually use our brain. And it lights up more when we are forced to use the brain and actively think about things. But when we're not there, it's not all lit up like that. So we're not using our entire brain on a regular basis. And then we have patients that have brain injuries, and they should be devastating, but they're not, because the patient has ways to create new connections that it's just, how do you answer that either? And sometimes I just look and wonder.
Yeah, that's another thing. Neural pathways, because I know sometimes, like, if you take the same route every day, like, okay, your brain has already committed that to the subconscious mind. So it's like, it's just the same, it's nothing new. But like
Yep.
sometimes just simply taking a different route to work, or like eating a different food, or wearing a different color that you normally don't wear will like start to just awaken some different neural pathways in your brain. It's
Absolutely.
fascinating.
Yeah, absolutely. It's
Yeah.
so I'm a big runner too, and one of the things they say with running is don't run the same path all the time, because your muscles start to get used to it. So run a different path, even if you just turn it around and run the same loop a different direction. It tricks your mind enough into thinking that you're doing something different. It's that same thing with your day-to-day activities. If you're doing the same thing over and over again, you're always going to get the same results.
Yeah. And I think the mind, because that's the part we can't see, right? We can see
Mhm.
the brain, like we could get MRIs, we could get scans,
Mhm.
we could look in that, but the mind is like this quantum field that no one can see. And I think that that's connecting some things as well. That is a lot of research. A lot of people are out there talking about it, but I think it's still a lot that's very unknown.
Absolutely.
Yeah.
100%.
So, Mandy, what are some things you're doing now? How can our listeners reach you if they have any neurological issues, or if they need treatment with headaches?
Mhm.
What are some things that you're doing?
Yeah, so I have an 8-week program that is focused on trying to find those lifestyle modifications. What is causing your headaches? Called mitigating migraines. So I'm starting up that program. It's set to start up here very soon. I'm always open for more clients for that. I have a social media, so I'm on Instagram, I'm on Facebook. I have a Wellness Wednesday topic that I post a little video on my social media on Facebook every week. So right now in the month of October, we're talking about nutrition, actually. So every week is a little bit more on nutrition based on headache prevention and headache tips there. You can find links to any of that on my website, which is www.brainwellnesssolutions.com. So links to any of that are on there, including a link to set up a time to talk to me and to see if my headache program is right for you and looking for those lifestyle modifications.
Yeah, that's awesome. And headaches is a big complaint. I mean, we
Mhm.
get patients all the time with a headache. What are some alarming signs as far as a headache that people need to completely bypass you,
Mhm.
bypass and go straight to the emergency room? What are some of those
Mhm.
alarming signs with a headache?
If it is the worst headache of your life, you've never had one like that before, and it's just like a thunderclap headache, that is an absolute 911 emergency. Don't even drive yourself to the hospital in that one. Call 911 because they can start doing treatments on the way to the hospital. If you have a headache that has unilateral symptoms, meaning one side of your body is affected, it looks like a stroke, um, things like that, that would be another 911 emergency. Don't call me, call the hospital,
Yeah.
get in there because we need to figure out what's going on immediately. The lifestyle things can come after that.
Yeah. And is there anything else you can recommend outside of the hospital, outside of pharmacology, that other than reducing stress,
Mhm.
specific treatments that people could do, whether it's a tea or whether it's, meditation, or is there anything else that you could recommend that people can start doing to treat headaches?
Mhm.
They're
Mhm.
not severe.
Right. Some of the easiest things you can do that don't require lab tests or anything, I'm a huge proponent of natural supplements, magnesium being one of them. Women, especially, don't get enough magnesium in their bodies. So, magnesium is huge, not a pharmacological treatment by standard thoughts, but just trying to replace what we normally would have in our bodies. And especially for those of us in higher latitudes in the Midwest, we don't get a lot of sunshine. Vitamin D is a really easy thing to do as well. That's going to help with so many aspects of neurological health. An easy way to do that actually is to get 10 minutes of sunshine every day without sunscreen on, not in the heat of the day. So, not at noon, but 10 minutes, just get out there, get some sun on your face, on your chest, and absorb it the natural way. If you can't get it the natural way, then a supplement would be the next way to go.
Yeah, awesome. Well, I have just a few more questions and then we will wrap up.
Yeah.
At the time of this recording, what would you say is the biggest matter of your heart?
Hmm. I think just stress for our society because it's everything is in so much flux right now. It's hard, and I see a lot of people that are sad and not where they want to be. And I'm a fixer. I try to fix things for everybody, and I can't fix it for a lot of people right now, including people in my own family, and that's hard. So that's huge on my heart right now.
That is hard. Yeah, it's hard. It's hard when you just have to allow people to figure it out on their own. That is.
Mhm.
And then, what is a book or anything that you could recommend to our listeners? It could be on brain health. It doesn't have to be. Is whatever you feel that something that helped you along the way.
Mhm. Um, Actually, in the last several years since I was diagnosed with my own health issues, I've been really into Brene Brown because her
I
books
like
have been
Renee Brown. Yeah,
amazing. Yeah.
I
And
like
they
her.
just they hit you in all the feels. So not specific to brain health, but it just really helps you on a personal level. So you can learn to realize that everybody is going through issues and we all have a little bit of control over it, but it's just taking a little lighter aspect of it. So
Yeah,
anything by
I
Brene Brown.
have one of her books, Brave the Wilderness. I'm not sure if you read that one, but that was one of my
Yep.
favorites. And it was one of the ones that kind of put a nice spark and fire under me as well. So that's a
Yep.
really great recommendation.
Yep.
And so you mentioned your own health journey. Do you want to share
Yeah.
that real quickly before we wrap up? Was
Sure.
it in headaches, or I know you mentioned that earlier?
Yeah, so I've had headaches since I was a teenager. That was the genetic thing. So migraines run in our families, and I had to do a lot of soul searching to figure out what my lifestyle triggers were to try to reduce them. Did have one last week. I hadn't had one like that in 3 years. So it works when you can find those triggers. But when it started 3 years ago is when I got diagnosed with a autoimmune disorder, and that was brought out by stress. Went through a stressful divorce and came out the other end with a really nasty autoimmune disease that we haven't been able to identify exactly what it is. That's where
Mhm.
that whole puzzle still
Wow.
remains.
Yeah.
But on a day-to-day basis, it's managing my stress, managing my lifestyle, so that I can try to minimize the symptoms that I have with it because they don't go away, but
Yeah.
I've learned to live with it.
Yeah. Did you decide to take medication or a little bit of both or
I tried medications and I have one of those really sensitive systems where I had side effects to everything that they tried to put me on.
Mhm.
So mine ended up being that the only thing that I can do is lifestyle modification, which made it even more important for me to try to help other people as well, because pharmaceuticals aren't always the answer, because
Yeah.
sometimes it's more problematic than it is a gain.
Yeah. And was that your bridgeway into functional medicine, just going through your own journey?
It was, yeah, being a patient and then seeing what all other options were out there because I've been in the Western medicine world for so long that was my
Yeah.
lens that I was looking at the life at world through. And when I had that experience and going through that as a patient, I absolutely fell in love and started taking courses to get certified myself because it made that big of an impact on me.
Wow, that's awesome. That is so awesome. Well, Mandi, thank you so much for taking some time and shedding your light here with our listeners. We just finished talking all about brain wellness. Okay, guys, if you have any headaches, if you just want to get in touch with Mandi, make sure you reach out to her. This podcast is inspired by all things of the heart and soul. All right, this is how we connect our hearts with our minds for perfect alignment. So we appreciate you guys. Please like, subscribe, and share, and we will catch you at the next episode. Thanks, Mandi.
Thank you.